introduce our panel. We have Crystal Womack. Crystal is an athlete from the Bremerton Kitsap area. She's been an athlete for 14 years. She plays golf, bowling, figure skating, and she's also a health messenger with Special Olympics Washington. She serves on our board of directors and is just in general very passionate and amazing about helping her fellow athletes out with improving their health. Our other guest speaker is Partridge, Dr. Rebecca Partridge. She is a pediatrician at Virginia Mason Medical Center in Issaquah, and her medical interests include Down syndrome and emergency medicine. She's also a parent of a Special Olympics Washington athlete, and in her free time,
Just as everyone's filtering in, if you want to throw in the chat who you are and what your connection to Special Olympics is, what you're hoping to get out of our forum today, that would be great.
So this is just a quick little overview of what we will be doing today. Rebecca and Crystal's presentation will be about 20 minutes. We'll have some Q&A and we'll follow up with some resources that both Special Olympics Washington and the community provide. All right, and just some quick objectives for today. We obviously want to learn about COVID-19 and the impact that it's having on our population at Special Olympics with intellectual disability. We're going to talk about how to keep ourselves and others safe, discuss a safe return to activity, and again, go over some resources that Special Olympics Washington has. So I will pass it over to Rebecca and Crystal.
And Crystal, please don't hesitate to jump right in if there's something that you want to add. So I'm so grateful and excited that I get to talk with you today, because I get to talk about really my two favorite topics of all time, which is number one, people with intellectual disability, and number two, infectious diseases. So I'm showing, since I got to make a bunch of the slides, you're going to see a lot of pictures of my kid because I'm super proud of him. Josh is 18, he graduated from high school where he had an amazing experience with unified sports. Basketball is his favorite sport. And so I specialize particularly in Down syndrome, obviously because of my son. And so I love it because I get to see people with Down syndrome all day at work, and then I get to spend time with my son and then my typical daughter as well in the evening. So I'm definitely living my best life here. And if you want to move to, the second reason is not only am I a parent, but obviously I'm a physician, and I created the Down syndrome program at Virginia Mason, and I get to do research with this handsome fellow on my right here, Bernard Kaur, and I value the amazing and incredible diversity that people with intellectual disability bring to our world. And so when I first learned back in really March that coronavirus was something that was actually going to impact my life, my personal life and my professional life, my first concern honestly was for my kids. How is this going to affect my children, most particularly my son, who is currently actually doing a great job with masking, but isn't the best at hand washing and isn't the best at keeping his hands away from his face. And how can I best keep him safe? And so hopefully I'll be able to provide some answers to you today, although I am going to start with a caveat that everything I say today should not take the place of visiting with your own loved one's doctor, because every case is unique. So what in the world has been going on the last 6 months? What has 2020 brought us? So the virus itself is actually named SARS-CoV-2. It likely originated in bats, and then it actually probably transmitted itself to this cute little fella in the middle called a pangolin. and then it actually transmitted to people. And this virus is unique among other coronaviruses in that person-to-person spread obviously is really, really easy for this virus. Coronaviruses have been around forever. We've known about them forever. There are 4 coronaviruses that just cause a common cold. There are 2 other coronaviruses that are actually pretty difficult to catch, but can make you pretty sick. And then there's, of course, our brand new one. So there's a lot of debate about when coronavirus came to the US. The most recent evidence is there was probably very limited spread starting in late January. So when I talk with people that say, oh, you know, I was really sick back in December, I think I had it, unfortunately, that's not the case. And you probably everybody who got sick in January and probably February didn't have it either. But we find that we were first able to actually detect enough cases. We had enough cases starting in February that it could actually be picked up. And if you'll move to the next slide. So COVID-19 is the disease that's caused by SARS-CoV-2. And COVID-19 was named because this is the coronavirus disease identified in 2019. I'm sure that you've been asked when you go out to places if you have any of these symptoms. The most common symptoms are fever. It's a dry cough as opposed to a wet cough, shortness of breath. People often say they feel really, really achy and super fatigued, sometimes more fatigued even before they develop symptoms. Headache is very common. One thing that's unique to this virus is commonly people do develop a loss of taste and smell, although that's not permanent. Then there are also some GI symptoms that you can get, with diarrhea being the most common one. And that's even more likely to happen the younger that you are. So next slide. So how do you get COVID-19? And the long and short of it is we probably all get it from droplets. So this really cool picture of a sneeze with all of these particles in the air. Those particles, when we sneeze and when we cough, we can actually push particles out up to 6 feet. That's where the 6-foot barrier came from. But if those particles are sneezed or coughed out into the air and you breathe them in, or obviously those particles are gravity is going to pull them down and they're going to settle on surfaces. And so if somebody does a great big cough someplace on a countertop, and then you come and touch that countertop and pick your nose, then you're going to get coronavirus. There's a lot of debate about how long this can live on surfaces. There's some debate about how long it stays suspended in the air. It's probably not very long as far as like how long you can catch it. It's not like measles, where you'll sometimes hear from on the news that if you were at the airport between this time and this time, measles is airborne. COVID-19, the best, as far as we know right now, is actually spread through these droplets. And next slide, please. So who is at risk? Who do we need to worry about? People with increased age. In the typical population, it is around 60 that people seem to be more at risk. There's some evidence that that may be younger in some individuals with intellectual disability. For instance, in Down syndrome, it's looking like it might be 40. People that have heart disease, coronary artery disease, like the type that we get when we're older and our arteries get clogged up. People that have diabetes are at higher risk. People that have chronic severe lung disease, often the type of disease that you get as you get older. And then the big question we're hopefully going to get some guidance on today is, what about people with intellectual and developmental disabilities? So next slide, please. Thank you. And probably some of you have heard this or seen this. So when I put into my search engine intellectual disability and COVID, this is covering the first page of search results. And look, the challenge with this report is that they're lumping everybody with an intellectual disability together. Now, again, one of my favorite things about people with intellectual disabilities is they're so incredibly diverse. They touch all age ranges. They touch all ethnic and socioeconomic groups. The underlying cause, if it's even known for intellectual disability, is really, really diverse. And so, as a great big giant group, if you take this giant group of diverse people and try to make them one group, then it does look like people with intellectual and developmental disabilities are at higher risk. But again, we have to think about everybody as individuals, and we have to think about individuals' risk on a person-by-person basis. So when you see this, it's really triggering. It is really scary. When I actually saw this article for the first time, it scared me to death. But looking and diving deeper, I actually realized that my son actually isn't in this high-risk group, although your loved one might be, for lots of different reasons, and we'll go into those a little bit. So how, I imagine probably everybody knows this to some degree. How can I avoid getting COVID? The very best thing that we can do is try to not come in contact with the virus. That is the very best protection for all of us. So avoiding crowds, avoiding being around places where there are a lot of people, especially if you're not able to stay 6 feet apart. So you can be around people, it's just you want to be able to maintain that 6 foot distance. Anytime you can be outside, it's going to be safer than being inside. Wearing a mask, definitely, we wear masks because they allow us to protect each other. I wear my mask to protect you, and you wear your mask to protect me. There is some evidence as well that eye protection might be helpful. If you're around somebody and they cough, you can actually, through the living cells in our eyes, get coronavirus. And so when I'm at work, and actually I have a really comfortable pair of goggles, and I just wear them to the store. If you wear glasses, that does provide you some protection as well. And then of course, washing your hands. This is one of the few microbes we know of where hand washing with soap and water actually works better than hand sanitizer, but hand sanitizer is a great backup if you don't have access to soap and water, like if you're out doing your grocery shopping. So what do I do if I get sick? This is a huge question right now. And the challenge is we all need to still be able to access our regular health care and our regular doctors and our regular medications. So if people get sick, the best suggestion that I have is to call your doctor and to talk with your doctor about what your symptoms are and what your risk factors are and whether or not you need an appointment. A lot of facilities, including my own, Virginia Mason, we have telehealth visits available now, so I can see patients without actually making them leave their house. If it's safe for you to stay home, that's the very best place you can be. And just like with anything, anytime you get sick, you want to rest, you want to drink plenty of fluids, and you want to talk to your doctor about what medications might be helpful to relieve your symptoms. And then one of the best things you can do is isolate, is not go out places, not be around other people. Until we have a safe and effective vaccine, the very best thing we have in our arsenal to stop the spread of coronavirus is by not having people around coronavirus. So what about my loved one? And again, this is a great time to review with your doctor what specific risk factors your loved one might have. We have to think about other health conditions, like we talked about heart and lungs and diabetes. Certainly if your loved one is on medications that suppress their immune system, like treatment for cancer or autoimmune diseases, those are conditions to talk with your doctor to find out how much at risk is your loved one. We also have to consider the living situation. We do know that people that live in group homes and institutionalized settings are at higher risk for developing coronavirus because there are more people altogether and more people coming in and out of the facility. We also have to think about the extended family. As much as I adore my son, and he and my daughter are my two favorite people on the planet, we're all part of a system. So I have to consider the fact that I have to go to work during the week, and I'm actually seeing patients. And so My regimen when I get home from work is I immediately Clorox wipe my phone that I've been touching all day, and then I go into my bathroom and take off all my clothes and take a shower before I do anything else, before I sit on the couch, before I hug my kids. And that's my way of keeping my kids safe, because they don't just exist in a bubble. They have to be around me and I have to be around them, and I want to keep them as safe as possible. Another consideration is how well your loved one is able to keep themselves safe. Is your loved one able to tolerate a mask? I have many patients that developmentally are not able to tolerate one. And we've talked about other options like face shields or just keeping them at home. Is your loved one able to stay 6 feet away? Some people with intellectual disabilities really love hugging people, but this is one of those times where that's a huge challenge. And is your loved one effectively able to not touch their face, especially when they're out in the community? Those are all considerations for at how much risk your own individual loved one would be. We have to think about ways that we can stay healthy during this. Physical health, we talked that the biggest problem is actually exposure and opportunities to come in contact with the virus. So in general, just doing what you've been doing for the last couple of months. You want to eat a really balanced diet with lots of color. People often ask me, how can I boost my immune system? And one of the very best treatments for our immune system is eating a really healthy diet and making sure our body has the nutrients it needs to stay healthy. Exercise is great for your immune system, plus it's good for your muscles and your heart. It's good for your mood. We want to everybody get a regular amount of sleep. We know if you're not getting enough sleep, that can suppress your immune system, and we want you to try to stay on a regular sleep schedule as much as you can. A lot of people, especially teenagers, have shifted their sleep schedule, so they're staying up super, super late and then sleeping until the afternoon. And if that's having an impact on mood, that's a really important consideration. We want to all drink plenty of water and get our regular vaccines. For people that are able to tolerate the flu vaccine, I think it's a really important concept, especially this winter, because with all of the regular viruses plus flu plus coronavirus, if we can take one virus out of the mix, it'll make your life a lot better. We have to think about the fact that our loved ones aren't just physical bodies. They have emotions, and their mental health is really important. My son, we've had some struggles with him losing the structure of school. So trying to find other ways to provide as much structure as possible, but also offering him choices. Again, exercise is really, really important for emotional and mental health. It's important to talk with your loved one about coronavirus, to explain in a developmentally appropriate way what's going on. Why do we not get to go visit grandma right now? Why do I not get to go to school? And why is my graduation a drive-by dance party, which turned out awesome, by the way. But giving them as much information as is appropriate so that they have an understanding about why this is so important. And when emotions come up, which they definitely will, feeling really sad that you had to miss a birthday party, feeling really angry or disappointed, those emotions are really, really important. So validating those and then trying to find substitutes for regular activities. So instead of my son's regular high school graduation, like I said, we did a drive-by dance party. He was set up under a tent. He picked the playlist. He got to dance for all of his friends. And we handed out chips and guacamole as his favorite snack. And it actually turned out really great. Sorry, that's my son in the background. So next slide, please. We have to think about the fact that all of us are social creatures. We weren't built to be completely by ourselves. And so we have to explore creative ways to build those connections. We have to think about what level of quarantine is most appropriate for your loved one's situation. It might be that the very best thing for them physically is that they need to not leave the house, especially if they're in a high-risk group. But my son and his best friend have been great about staying 2 arms apart, which is right around 6 feet. Sometimes they have visits through our slider, and that works really well in addition. And especially when they're outside with the 6-foot rule, they're able to have their epic dance parties out in our backyard and still maintain a really important social connection. And of course, they're doing a lot of FaceTime, and they really enjoy making TikToks together. We have to think about ourselves as well. Just like when you're on an airplane and they say put on your own oxygen mask first, as parents and caregivers and coaches, our first instinct is to put the people that we love first. But the challenge is, if you're not getting enough oxygen, you're not going to really be able to help anybody else. So making sure that you're paying attention to your own exercise, making sure that you're listening to and validating your own emotions. I've sometimes felt like I have whiplash because my emotions can change so fast. Sometimes I'm sad about the quarantine. Sometimes I'm angry about the quarantine. Sometimes I kind of like it because my kids are forced to spend time with me, and that is lovely when they're teenagers. And also circling your own support wagons, thinking about what support system you have. Is there an opportunity for someone to provide some respite care? Is there an opportunity for you to go ahead and take a break? Because this is a difficult situation for all of us. And next slide. So I've listed just a couple of additional resources outside of the regular resources that Special Olympics Washington offers. Some caregiver options. There's a disability form that's available at this website and actually also at familiestogetherinc.org. And this is helpful to fill out ahead of time in case your loved one ever needed to be hospitalized for coronavirus. Visitors are very, very limited in that situation. And so being able to put down on paper the very best way that your loved one communicates, what your loved one enjoys, what name they prefer, those are all really, really important things for doctors and nurses and people in the hospital to know, and to get to know your loved one as a real person, because they're not just somebody laying on a bed, and let them know how to best communicate with them. The familiestogetherinc.org was originally created as an education resource, so for families advocating for IEPs and services, but they have a really nice section on their website right now about navigating COVID-19. It has social stories, it has caregiver ideas, it has structure and activity ideas, all focused on my very favorite people. So I am delighted that I got to prepare this. I always love showing off pictures of my kids. And there's my contact information if anybody needs anything. And I've just talked for a really long time. Crystal, what do you want to add?
Okay. That's on. Actually, you pretty much covered it all, but as an athlete, I understand the whole disease part because I have a heart condition, a heart defect, which affects I only have 3 chambers instead of the typical 4. So I'm at a high risk there because my oxygen is typically lower. And then I have diabetes. So it's like a double whammy. So I know what everyone's going through. I really do. But the exercise and the eating healthy and just keeping your mind focused on what you can do just to keep you occupied is really good to help.
And I agree. One of my biggest challenges is figuring out how to fill my son's day.
Mm-hmm.
All the regular activities and the things that he would typically enjoy, like going and playing basketball with his friends. And, he was really looking forward to playing soccer this spring. And that's been really difficult to find a substitution for. So I really appreciate that comment, Crystal.
Yeah, and I actually, the other thing I do is my friend that I'm staying with, she drives me around, and because I play Pokemon Go, I do that as well to keep me occupied. But it's good exercise as well, because if you play it and you know what I'm talking about, you get more distance if you're walking more a lot too.
That's a great idea.
Pokemon Go is like the perfect game to play, but safe-wise. Play it safely.
That's awesome, Crystal. Thank you both so much for sharing. Rebecca, I really appreciated all of your comments and advice. I think that was really helpful. We have a few questions that were directly in response to your presentation. And then if there are other questions that come up, that would be great. We also have a quick poll of some questions that we would love to get answered from all of our attendees today. The first, or let's see, we have two questions that came in. The first one was about the efficacy of Lysol and how helpful that kind of spray is.
So Lysol, I think, can be helpful to help decontaminate surfaces. As I haven't seen some, I'll have to check and make sure that Lysol kills coronavirus. Bleach definitely kills coronavirus. And I know that some people are like disinfecting their groceries and things like that. The most recent orientation is that we're probably okay without doing that, although you have to do what you feel like makes sense to you. Let me double check on the Lysol question, but I can tell you for sure that bleach kills it.
And then the other question was just asking for more information about face shields.
Mm-hmm. So face shields, I think masks are the best. Face shields, I think, are a close second, especially for people that can't tolerate a mask, or for people who have hearing differences, and especially if someone needs to be able to see your mouth move in order to best understand. Face shields, I think, can be a really good option. Face shields, obviously, if you're coughing, singing, breathing, all of these things, face shields are still going to catch the majority of the droplets before they go out. So the formal recommendation is still to mask if you can, but for people who can't tolerate a mask, face shields, I think, are a nice option. And there are some really great ones that have like cartoon characters on the front, so it almost looks like an Instagram filter. You can make your child look like a cat or a mouse or something.
And Kate, if you have any more to add to that question, you can go ahead.
Thank you. Yeah, this is Kate Orville. I was wondering, I have a friend who's an adult who can't tolerate masks. So is that, and she's been very frustrated. I mean, I think we need everyone masked who can be to protect the community, but is that something that if she were wearing a mask that she would be allowed to go into a store, or say into Fred Meyer's or the grocery store? I mean, not a mask, a shield.
Yes, I think, yes, she should be able to. And you can also, so I am very, very selective, but I have written a couple of letters for families whose loved one just cannot developmentally tolerate a mask, to allow them to go out in the community with the understanding too that, there probably is a little bit of increased risk. But I think the face shield is a good option. And I can't imagine that anybody would stop you if you're wearing a face shield.
Okay, thank you.
Does anyone else have questions they would like to ask? You can feel free to unmute yourself or use the hand raise feature. Oh, Crystal, do you have something you wanted to add?
Yeah, on the face shield, because I don't have sensory issues, the mask, because of my low oxygen rate, would that help as well? Because the mask, I get very out of breath with it, even walking, in a store kind of thing. And it's like, I could barely go shopping almost, and it's just really hard. Would the face mask be better for that as well?
The shield would probably give you better air circulation. And the masks also, they get really hot and stuffy. So
Yeah.
I would suggest talking with your doctor, and if your doctor feels like it's not really safe for you to wear a mask, I think a shield would be a great second option.
Okay. Thank you.
I have a question, but I don't know how to raise my hand.
Go for it.
Okay. This is Susan Greenwood. I won't put me on video. I'll spare you any. Forgive me, Della and Leah, if I know I missed a lot of your videos posted online on Facebook over the last few weeks. I've had my own health issues. But is there, going back to Crystal, saying that she's doing Pokemon Go and things like that and exercises, is there something like, now that the weather's starting to turn nice, maybe a scavenger hunt while you're out on a walk to, look for this, or every tree you do this, or, something fun or anything scavengery, or kind of add to just exercising or add to just a walk or things like that. Is there anything like that out there, or?
Yeah, that's a great question. And Crystal, I think that was a really good segue. I know that some of the areas around the state have thought about doing scavenger hunts to provide some incentive just to get outside and go for walks. As of now, Della, correct me if I'm wrong, as of now, I don't know of any specifically that have been created and have started, but I think that's a really great idea, and especially hearing your feedback, Crystal, that's even more of a reason to get something like that going.
I was gonna add something to that
Yeah.
too. If like you said, Susan, that like a certain tree you do this many things. I think it's more of a self-starter kind of thing. But if there is scavenger hunts out there, that would be great too. But it's one of those, you kind of have to think of, like, imagine something up kind of thing, because I do it myself. Like, every time I pass our mailbox, it's like, okay, one lap, I do this or drink water because I know I need water to keep me going. And yeah, it's one of those, you have to self-start it kind of thing. It's really cool though.
Because, a walk for me, there's a tree every few feet, and that's easy. Whereas an athlete doing it in Eastern Washington along the wheat fields, you may have to go a while before you get a tree.
Yeah.
I'll do a little bit of research and see if there's something that exists currently that we could send out.
Just something fun to add to a walk to get them out in the fresh air. And I don't know, just trying to think of things out on the track, but since I'm track and field.
Grant mentioned in the chat something that we're going to bring up later as well, but we've got our virtual summer games coming up soon, and so we definitely want to encourage
Very good.
Participate in that as well. But I think we have some eager health messengers like Crystal who might be willing to take on that scavenger hunt activity as a fun little job. So thanks for bringing that up, Susan.
Chris Rice asked if you could repeat the name of the resource for notifying a hospital of personal characteristics or needs.
Absolutely. It's called a COVID disability form. And I think, are we going to post the slides?
Yeah, I will. We'll post the slides, and I'll share in an email out to all of you where those are located, and I can specifically list that resource.
Perfect. And yeah, they're available at selfadvocacyinfo.org as well as familiestogetherinc.org.
Could I ask a question? I'm wondering from some of the athletes here, if there are things just like Crystal, you were talking about Pokemon Go, if there are other things people are enjoying. My son, Liam, who's 22, has been doing, and he's an athlete, he's been doing some dancing parties with friends online. They've been doing like messenger groups, or anyway, using iPhones or computers, and this, a lot of dancing and having fun with that. And I wonder if there are other things people are doing that are fun that we could learn from.
I think I know DJ Shane is on here, and he's been doing some dance parties every once in a while, and he posted on Facebook a few times. I know there's that, but you kind of have to watch out when he does it. But I think there's that. Of course, what you mentioned is really good. FaceTime, like iPhone and FaceTime. I think I only know about the DJ Shane part, though.
What do you want to share what you've been doing? William's another one of our health messengers.
Yeah, I've myself and Amber Wagner, her and I've been doing exercise classes, virtually on Zoom, and of course, we're just starting our program, but I thought that'd be an idea for everybody, just to get outside at home, and if you got a computer, you can do exercises online.
Yeah, and I logged on to one of those and did one, and it was super fun. We're going to mention it later as well, but every Wednesday at 4 p.m., with the exception of this coming Wednesday, since we're coming on to a holiday weekend, we are doing a live Zoom workout for all of Special Olympics Washington. We're going to be doing it for the rest of the summer and probably into the foreseeable future. So we definitely encourage athletes to hop on those workouts. They've been super fun. We've done kind of a combination of some yoga and stretching, and then some more high intensity. So there's something there for everyone.
I can share in a follow-up email to some other organizations that I know of that are providing some virtual, more social, fun kinds of programming to keep everyone active and engaged.
I was just going to say, we also have Garrett that's on the line, another health messenger. Wow, good work. Attendance, everyone. Garrett, did you want to unmute yourself and share what you've been up to at all? You don't have to.
I mean, if you guys want me to, sure. So I've been, the things I've been doing, like I said, my season didn't happen this year. So my determination was just to get ready for the next season. So I've been, trying to get on a soccer field every day. I'm actually back in Issaquah, so I've been doing that, and I'm going to continue to do that. I've been walking with my dad in the Tri-Cities heat, and it's not very fun, but it's something to do. It's something to do if you're getting ready for the season. I've been, doing a lot of things with Special Olympics, so that's gotten me, not thinking about COVID as a mental state. I've been communicating with my teammates, coaches, just checking in. So that's what I've been doing.
Cool. Thanks for sharing, Garrett.
Does anyone else have any other questions for Rebecca? I have some to throw in if not. Great. Well, I think a big question, Rebecca, that I have is, all of our communities are kind of starting to open up again. At the same time, there are, increasing rates and death rates, and it's a little confusing. As Special Olympics is beginning to open up, are there specific things that you would recommend for athletes or parents to look for and think about when they're considering going back out and socializing more than they have been?
Absolutely. So I think reviewing, if you're really comfortable with what your loved one's risk factors are, that's great. But if not, I would review those with your loved one's doctor and to see if there's anything in particular that you need to consider. But other than that, I would just want to know from the group hosting the activity, like, what's the plan? how are you going to help maintain social distancing? Are masks required? Because honestly, masks I think are really difficult to wear while you're exercising. So, what is the plan for using hand sanitizer or disinfectant? What's the plan for keeping people 6 feet away from each other? How can we make this fun but also make this safe? And if I heard from my son would love to participate in a Special Olympics group, and I think as long as there was a solid plan in place, we're like, yep, we're gonna have extra people on site to help remind people to stay away from each other, and we'll have and everybody will be required to use hand sanitizer before and after, and we'll maybe stagger exit times if you need to, then I personally would feel really comfortable taking my son. And actually, I'd be really excited. I think it's my son's really kind of itching to get out, but we want to do it in a safe way. So I would personally feel really comfortable doing that.
That's good to hear, and that's definitely the goal is, get everyone back out, being active, seeing their friends as soon as possible, but of course, in a safe and healthy way as much as possible.
Could I ask a clarifying question? Dr. Partridge, when you were saying you would ask about what the plan was for masks, is that because you're assuming that if people are playing soccer outside, that they're really not going to be able to keep the masks on, and so what are we doing in place? Or would you want to know that everyone was going to have masks on the whole time?
So I would, depending on the activity, certainly I think if it's a breathing heavy activity, I think it's asking a lot to have people mask. So I would want to know, what are we going to do instead of masking? Like maybe we run drills rather than play a scrimmage game, because it's a lot easier to maintain social distancing if you're not actively trying to get at the ball.
Okay.
So I think with, there's some people that do sports with their mask on. I think it's a lot to ask.
No, that's a helpful clarification. So maybe it's asking the organizers to think about how they're going to adjust, and as opposed to just doing the same thing and putting masks on, thinking about how do we exercise and have fun, but do it in a way that's safe without needing masks while you're panting.
Exactly. Put it beautifully.
And would you say that applies to people regardless of where they fall in, being high risk or being less high risk? Does that change how you would feel about that?
If we're doing an activity outside and there's a plan in place and there's the appropriate support to keep people 6 feet away from each other, the only other thing I think about is just the family. Like, what are the family's unique risks? Because it may be, if you're living with your 95-year-old grandmother, it may be too risky to consider bringing something in. But depending, if you're participating in Special Olympics, then you've been cleared by your physician to go ahead and do this. So I think as long as this is done in a really thoughtful
have some
manner,
resources that we would like to share from the Special Olympics side of things. This slide here shows some of our local ongoing volunteer support. So we have a map at the bottom showing the way that Special Olympics geographically organizes our state. Within each of those areas, there are local volunteers who work to support that region. And a few of our regions are fortunate enough to have some ongoing volunteers who work directly with our families and with our health programs. So here's just a list of some of the locations where those people exist. And we'll be sending out some information about their contact information. They're an additional resource to reach out if you're looking for some referrals or additional resources. Great, and then I won't go through all of these resources here. This is more just to emphasize, we'll be sending out a resource list with a whole gamut of opportunities, some specifically coming from Special Olympics Washington, some coming from Special Olympics International, all resources educating our community on the coronavirus and how to stay safe. And then we have a few other resources that are coming from some other organizations in our especially coming from the King County, Seattle region, but then also as they apply to the larger Washington state, and as it applies to some specific disabilities. This is a timeline that demonstrates how Special Olympics plans to reintroduce our in-person practices. So we, before we start holding in-person practices and events, we are going to wait until the phase 4 plan coming from Governor Inslee. So at phase 4, that's when our communities are permitted to have large groups of people, but from the Special Olympics side of things, it is not until phase 4 that we will allow groups of 5 people. So that would be small practices with groups of 4 athletes and a coach. This will be a while before we reach phase 4, but we feel that it is necessary to feel really comfortable and safe before we are gathering our participants. And this will be included in the resources as well. I know the text is really tiny there.
And I did just want to reemphasize our upcoming virtual summer games. Both are really exciting opportunities, and as Leah mentioned, we will be sending out more information about both of these in the follow-up notes, along with a survey for athletes, families, whoever, about getting connected to some additional wellness group chats that are going to be happening via Zoom. They're 6-week-long sessions that'll focus on health and nutrition that we're excited to be rolling out in a few different counties. So be on the lookout for more opportunities like that. Last but not least, we wanted to announce the next date for our Family Health Forum. We haven't solidified the topic on this one yet, but forums are going to happen the last Monday of every month at 6 p.m. And we'll share the meeting registration link, and it will show up on your calendar as recurring at that point. So you'll never miss another Family Health Forum. And here is Leah and my contact information. Feel free to reach out to us with any additional questions that you have. And if you have more questions for Dr. Partridge or Crystal, please feel free and send those through us, or you can put those in the chat right now. We still have a few more minutes left.
Thank you all so much for joining us tonight, though. I think this is our first Family Health Forum that we've hosted, so it's really nice to see all of you. Thank you for having some great questions and comments. Feel free to let us know if you have any thoughts on future topics or any ways that we could improve, other resources to add. We're open for anything.
Thank you again.
Thanks so much.
Thanks. Don't forget to fill out that exit poll.